Dr. Victor Perez from Mexico. He's a great friend, great anatomist, and a great neurosurgeon. So, Victor, it's all yours now.
Thank you very much. It's very nice to see you all and to present this work about posterior circulation. Here we have a picture with the basal aspect of the brain. Here we have the basilar artery, two vertebral arteries. One of them is hypoplastic, and here we have branches of these vertebral arteries. The posterior part of the circle of Willis is one of the most difficult sites to approach surgically. The complex series of perforating vessels surrounding and arising from it, and its intimate relationship with upper brain stem, extraocular nerves. The branches are exposed in surgical approach to the basilar apex, tentorial notch, lateral anterior ventricles, and inferior temporal. Here we have a small video. We can see the small branches coming from the tip of the basilar artery. Here we have the P1 and P1, the other side, posterior communicating artery. In this model, we can see the abscess of posterior communicating artery in the right side. Look at this segment of the posterior cerebral artery. We don't have connection with anterior circulation. Here we can see also the thalamo-perforating artery is the biggest of this group of arteries coming from the tip of basilar artery, and they overlap with some branches coming from P1 in both sides. Here we have another video in which we can see the posterior part of circle of Willis. In this side, we have an hypoplastic posterior communicating artery, and in this one, we can see these branches coming from posterior communicating artery and also from P1 and P2. So this video is very useful to know the critical anatomy in this part of the brain. As you know, these branches are very important because they are irrigating the stem, brain stem. This is the posterior perforated substance, and here we have this thalamo-perforating artery. These are small arachnoid tissue, and the advantage to inject these arteries is to differentiate these small branches of arachnoid with the arteries. Here we have two pictures in which we can see the posterior cerebral artery and anterior cerebellar artery. This is an approach to this part of the brain. This is a good landmark to differentiate the posterior cerebral artery and the anterior cerebellar, superior cerebellar artery. Here we have some branches of P2, segment P2 with the posterior cerebral artery. These are temporal, anterior temporal, middle, and posterior temporal arteries coming from posterior cerebral artery. And here we have another beautiful branch that is coming most of the time from P2. This is the posterior choroidal artery. We divide in posterior choroidal, posteromedial and posterolateral choroidal arteries. You know that fetal configuration is the artery in which the proximal posterior cerebral artery, this one, is small, and the posterior communicating artery provides a major supply to the posterior cerebral artery and is larger than the P1. So this is P1. They are very short. Here we have another variation in the anatomy of these beautiful arteries. This is posterior communicating artery, and this one. They are both of them are fetal configuration, and this is a very long triad of P1 in the left side of this brain. Hypoplastic arterial segment is defined and one having a diameter of 1 millimeter or less, like in this view. This is a hypoplastic, is less than 1 millimeter of diameter. The posterior portion of the circle of Willis sends a series of perforating arteries into the diencephalon and midbrain. Some of the perforating branches arising from the upper part of the basilar artery overlap with some of those arising from the posterior circle. The risk of occlusion of these vital perforating vessels during tumor aneurysm surgery include visual loss, somesthetic disturbances, motor weakness, memory deficit, autonomic imbalance, diplopia, alteration of consciousness, abnormal movements, and endocrine disturbances. So this is very critical site of surgical procedures, especially aneurysm coming from the basilar artery. So here we have another video in which we can see absence of this posterior communicating artery, and P1 is giving some branches to the brain stem, to the posterior part of this anterior part of this brain stem. This is a posterior communicating artery coming from supraclavian carotid artery. This is P1. And is very known for all brain surgeons. So this is the main landmark in this approach to this region, the oculomotor nerve, and below of them is, below of it is the superior cerebellar artery, and above we have posterior cerebral artery. The oculomotor nerve in this site was accidentally cut during dissection. That's the reason we cannot see it here. So although you see a very small posterior communicating artery or PC or P1 segment of posterior cerebral artery, like in this case, you look that it's very small P1 in this site, but it doesn't matter if it is small or big. look in the next picture, the numerous arteries coming from this very small P1 segment of posterior cerebral artery. Again, I'm going to put this picture in order to differentiate these arteries. Here we have the basilar tip of basilar artery, and this is the superior cerebellar artery in the right side, and this is P1. This is very small, and then we can see numerous branches coming from this spectacular P1 segment of a posterior cerebral artery. Segments of posterior cerebral artery, they are 4 segments. The P1 segment, also called the precommunicating segment, extends from the basilar bifurcation to the junction with the posterior communicating artery. A fetal configuration in which the P1 has a smaller diameter than the PCOM, and the posterior cerebral artery rises predominantly from the carotid artery, occurs in approximately 1/3 of hemispheres. The thalamo-perforating artery arises on the P1, like in this picture, and enter the brain by passing to the posterior perforated substance. Here we have another picture in which we can see these small branches coming from tip of basilar artery and P1. They are coming from these segments of the posterior circulation and gives irrigation to this important part of brain stem. This is a closer view in which we can see the trajectory of these small arteries coming from this segment of the posterior circulation of P1 and basilar tip. This is another view of basilar artery, posterior cerebral arteries, and superior cerebellar arteries. This basilar artery was cut in order to make some dissection of white fibers of pons. But we can see in this video another beautiful view of these arteries. Here we have P1, the right side, P2, and oculomotor nerves, and some branches coming from P1 and P2 of this. And here we have some arteries going to the oculomotor nerve and brain stem. The P2 segment begins at the posterior communicating artery, lies within the crural and ambient cisterns. This is the crural and ambient cisterns, and terminates lateral to the posterior edge of midbrain. The posterior choroidal arteries, the branches of posterior cerebral artery, enter the lateral anterior ventricles to supply the choroid plexus and ventricular walls, are divided into medial and lateral groups referred to as the medial posterior choroidal artery and lateral posterior choroidal arteries. So here we have a posterior cerebral artery. This is a special variation. I have not seen other brain like this, because in this there is absence of communication between anterior and posterior circulation. This is the superior cerebellar artery, and these are P1, but look at this artery is giving rise to some posterior choroidal arteries, and some of them are irrigating the peduncular brain, the peduncle of brain. Here we have a dissection of choroid of arachnoid in order to see these arteries. You know that dissection of this arachnoid is very important to preserve the fine irrigation of brain. So now we can see the crural and ambient cistern. This is fourth cranial nerve. And this artery is a superior cerebellar artery. Here we can see the oculomotor nerve, and just remember that this is a very important landmark. The artery above this oculomotor nerve is posterior cerebral artery, and the artery below is the superior cerebellar artery. The P3 or quadrigeminal segments proceed posteriorly from the posterior edge of the lateral surface of the midbrain and ambient cistern to reach the lateral part of the quadrigeminal cistern and ends at the anterior limit of the calcarine fissure. This is P4, this is cortical, these are cortical arteries, and this is P3 segment or quadrigeminal segment. In this picture, we can see the posteromedial choroidal artery and its irrigation to the pineal gland. This is pineal gland. This is a closer view in which we can see these important arteries. This is quadrigemin plaque, and this is pineal gland, and this is a small arachnoid that fix this pineal gland. This is a posteromedial choroidal artery, and this is most probably P4 segment. This is Rosenthal vein, and this is trochlear nerve in the right side. The P4 segment includes the branches distributed to the cortical surface. Like in this case, we have in here middle temporal artery, posterior temporal artery, and the calcarine artery. Hippocampal arteries, when they are present, arise in the crural or ambient cistern, and is the first cortical branch of the posterior cerebral artery. It supplies the oncus, anterior parahippocampal gyrus, and a hippocampal formation and the dentate gyrus. This is a dissection of white fibers in this brain. We can see in here this hippocampal artery coming from this posterior cerebral artery. This is really a nice dissection because when you find this artery, you look how this artery is giving rise, is irrigating the hippocampal formation, like in this picture. Here we have another view of this. And,
one more minute, Victor, one more minute.
A closer view of this segment of the peduncular of the peduncles of brain, the oculomotor nerve, posterior cerebral artery, and superior cerebellar artery. And these small arteries are also very, very interesting. They are irrigating the brain stem in the mesencephalon.
Victor, one more minute.
Here we have another view of posterior cerebral arteries and its branches, mainly temporal arteries. The dysfunction caused by occlusion of the individual posterior cerebral artery has been reviewed in the subsection related to those branches. This is a text copied from this beautiful writing of Dr. Roton. And the description of many affections of the brain is the involving of hypothalamic pathways, mammillary bodies, autonomic imbalance, damage of sympathetic and parasympathetic pathways in the anterior and posterior encephalon, alteration of consciousness, and many other more. This is a picture in brain stem, basilar artery, posterior cerebral artery, superior cerebral arteries, and this is a very beautiful region of brain.
Victor, it's time now. Victor, can you hear me?
Here we have a superior view of the basilar tip of these arteries. This is posterior cerebral artery, giving rise to numerous branches that are going to the brain stem.
Victor, can you hear me?
View.
Victor, can you hear me? Victor, I don't know whether Victor can hear me.
This is a very interesting variation of this basilar artery, tip of basilar artery. This is superior cerebral artery, P1, and P1 in the other side, but we don't have communication here with posterior communicating artery. Cerebral arteries are defined in three neurovascular complexes: an upper complex related to the superior cerebellar artery, a middle complex related to the anterior-inferior cerebellar artery, and a lower complex related to a posterior cerebellar artery.
Victor, can you hear me?
Cerebellar arteries bear a consistent relationship to the superior, anterior-inferior, and posterior-inferior cerebellar arteries. Here we have superior cerebellar, anterior-inferior cerebellar, and some lower cranial nerves. This is irrigation of coming from the superior cerebellar artery. And here we have another interesting view of these arteries. And this is some dissections of these interesting arteries. I want to show you this beautiful view in which we can see the corticospinal. This is corticospinal. Look, the pyramid is located in here, and this is the causation. So I think that each brain should be dissected not only to study arteries and veins. Every brain should be dissected in order to understand the internal configuration, like in this case. Thank you very much.
Thanks very much, Victor. Can you hear me? There was some issue with your speakers. Can you hear me, Victor? Can you hear me? Victor, can you hear me? No, I don't think he can hear us. Maybe we'll ask him the questions whenever he can hear us. We'll check with him whether he can hear us. Then we'll ask the question that has been presented through the chat window.